Good morning. This is Dr. Brad again. We're going to jump back in and continue this dynamic, raw conversation with Dr. Deb. She's talking about her book, but the backdrop of this book is a whole bunch deeper into the vulnerable issues of the doctor-patient relationship that women have with doctors. And it's amazing that she says that that's worse with female doctors than it is with male. And I was a bit surprised by that, but I assume she knows more about that than I do. So let's just jump back into the conversation right here, and we're going to continue this conversation. Yeah, yeah, and the things that people don't look at, belief systems,
Yes.
relational health, stress issues,
Yes. Mm-hmm.
those you look at in a collective whole when you sit down and you connect with people,
Mm-hmm.
which I would imagine with what your practice is, you're stuck in this somewhat of a limbo because the medical system is so tied up in your aid on a diagnosis, and you're only allotted so much time
Mm-hmm.
to get that, typically 6 minutes, which
Yes.
isn't adequate to do anything. And chiropractors are aiming for the same type of thing. I know two chiropractors, their patient turnover time is 2 minutes.
Wow.
And you'd think that's just insane.
Yeah.
And they're just extremely busy because people love it because there's no inconvenience.
Mm-hmm.
Absolutely none. But when you look at helping people resolve real issues, if you can't sit down, look at them horizontally right into the eyes at eye level, not this condescending thing, but get down at eye level, look at them and connect, you have no concept of the history of what brought the person to this place. And the history is really where all the keys are.
It's everything. Correct. Yes. When I see people, we spend about an hour with our patients, sometimes a little longer. I want to hear their story. I don't want to read it on paper because things get lost in paper. I want to hear it. I want them to tell me. I want to be able to see their reaction as they're telling me about their life story and when things happen and how things happened and who integrated into their lives. Because you're absolutely right. That's where all gold lies. Like
Mhm.
you could hear somebody's story and pretty much tell them what's going on with them without doing laboratory finding. We do it as a confirmation, an objective part to things, but you don't really need it a lot of times.
Yeah, my histories are different because I've created my own system-based
Hmm.
questionnaires so that I have this running history written.
Hmm.
Because if I ask questions, it'd be over 3 hours to
Hmm.
get it. And then we dialogue for commonly an hour off. If it's complicated, it's going to be longer than that.
Hmm.
Simple one to be a little less, but average is close to that. So
Yeah.
we can talk about real issues
Yeah.
rather than having to wade through all of this,
Mm.
these distractions.
Yep.
But we're both looking at it the same way, which you're the only other clinician I've ever heard that says, I'm looking for the story.
Hmm.
That's the gold,
That
isn't
is.
it?
It is the gold. Hmm.
Because
Yeah.
the story gives us the roadmap of how you got here.
Exactly.
How you got here is those have to be retraced
Hmm.
and undone, and retracing with replacing with the proper, healthier choices to actually build health instead of tear it down.
Hmm. Absolutely. I mean, sometimes you hear a story and you realize that what happened to the person when they were 5 or 6 years old is really what started them on their trajectory, even though they may be 40, or the places they lived in when they were younger. Where did they move to? Where did they live in? What was their exposures? Those kinds of things. That really, I love it when people come to me with a timeline of their life because that's really, that is really gold because
Yeah.
you can skip through a lot of different places and start to figure out exactly what happened to them and where and when and why and what happened with their parents and things like that. It makes a huge difference.
I have timeline in my questionnaire. I want people to go back as many generations as they can, especially on the maternal side. And this is something I think shocks a lot of people. But the last studies that I saw on this, is that a woman's health when she gets pregnant determines the health and the outcome of at least 5 generations.
Yes.
It's that big of a thing. You also have a spiritual side of things passed down to the
Mhm.
second, all the way in the seventh generation, go farther than that if no one ever broke the chain.
Exactly. Yeah.
And it's in those historical timelines going back in generations. People think they're locked in with this genetic code. They don't realize it's epigenetics that really matters. And you
Mhm.
see those patterns in the generational history, right?
Right. Right. You know, we treat a lot of women too, and a lot of our women are anxious to get pregnant, and we always try to explain to them like getting pregnant when you're sick is not the best thing in the world for you to do. We don't want you detoxing. We don't want you doing all of these things. But if your body is not in a good state, you're not just affecting your child, but like you said, generations to come. And sometimes that's what makes them step back and go, wait a minute. Okay, if it was just my child, I could fix my child. But when they think about it being 3, 4 generations out that nobody will know about, that is a different story. It holds a lot more power to them then to be the healthiest they can be.
Yeah. My son and his wife, they're pregnant with their fifth right
Okay.
now. And I had a talk with him a little while ago about what commonly happens with a woman when she does not have the help and the direction to rebuild all her stores. And she depletes herself. She starts to have more health problems with each child.
Yeah.
And the children tend to be less healthy with each one if she doesn't understand basic lifestyle issues, which they're not taught.
Oh, none of us are. Women
So,
are taught to be superhuman, right? Burn the candle at both ends, raise children, be a great mother, be a great wife, be a great career person, be a great daughter in law. But somehow in all of that, you're never taught how to be the best version of you.
which is an interesting thing. I grew up in extremely dysfunctional background, and I was a very young age when I don't want to perpetuate any of this.
Yeah.
And it's interesting because Lord got a hold of me, and he basically told me, quit looking for an example to follow. I'm going to teach you myself,
Mm.
which I was thankful I learned to hear his voice,
Mhm.
because it's funny how it got a hold of me, but, I was completely the other way when he got a hold of me. It was a pretty dramatic issue
Mhm.
and a complete turnaround, and he made me into somebody that I'd never met in my life. And other people have never met anybody like he's made me because he forges us into
Mhm.
his own character
Yes, he does.
if we allow him, and that's a interesting process. But in that, I learned some basic truths that I did not know. When you look at things like a belief system,
Mhm.
if mom's a faith, 25% of children will follow. If dad is,
Mhm.
75% of the children would never leave that.
Wow.
People don't realize it is the self-worth, it's the security, it's the value, it's all of these things that give us security in our life
Mm.
come from dad.
Mm. That's interesting.
And the reality is he is the representation of who God's supposed to be. If he's stoic and aloof, you have no building of those value issues. If you have condescending types of the things, you have a destruction of those type of values. If you have absenteeism, it's a destruction of those. It takes very intentional interaction to do that. And I've been all over the world doing ministry, and my primary fellowship's been ministers for long periods of time. When I was interacting with this apostolic group, the chief apostolic guy says, "You need to be traveling all the time. You're too intense to be any place. You're going to just fry people. So you
Mhm.
need to be traveling around a lot. You just can't stay in one place." That was one thing he'd always tried me with. Another one was, "Why are you always spending time with all these kids
Mhm.
doing horse stuff and all these kid things? You need to be out on the road doing ministry." And we get down later and he goes, "I don't get this. All your kids graduated early. They all want to go to college. They're married. They have families of their own. I can't get my kids out of my house. What gives?"
Mm.
I was spending all the time that they're off ignoring their family,
Yeah.
thinking God's going to raise them,
Mhm.
raising not only my own, but I did a wedding a few years ago, and one of the uncles of the groom asked me what children I had, and I said, "I have no idea." And he goes, "Boy, that's a weird answer for a minister." I said, "Well, you got to understand, I got 30 years of prison ministry under my belt. I've been all over the world. I poured my life into others, not for my own anything, no compensation, and never look
Mhm.
for recognition, anything like that." And the thing that there's so many people that look to me as a dad.
Yeah. The father figure they didn't have.
And by the end of the wedding, he came up to me, "I see what you mean." But these people that I spent time with, that their parents didn't spend time with, that I spent time with, to help them fulfill their own dreams.
Mhm.
The confidence that gave them, it makes them stand out above all of their peers around because someone took the time to sacrificially invest in them and never ask for anything just because they saw value. That's a dad's place and home.
Mhm.
And most men don't know that.
Yeah, I would agree with that. Most men have never been taught that, so therefore they don't know, and their absenteeism for all of their children is doing us a significant disservice in this country.
Yeah. And you look at the absenteeism up in the Northwoods where
Mhm.
you're at. The common thing for men to do, they never put their balls away.
No.
They're chasing balls at all ages.
Yep.
They're hunting and fishing addicts, and
Yep.
they leave their families. The opening for fishing season is Mother's Day.
Yep. Mhm.
What a dig.
Yep, and then when they're done doing that, then they race off to the bar to be with their buddies and hang out there and come home after their children and their wives are in bed, and they are completely absent.
Hmm.
Yeah.
Yeah. And it's
Mhm.
so this the name of your book to be seen. You have this. It is so counterculture, but the title's so subtle. If people don't understand the culture, they won't get it.
Right. Yeah, and I think, you know, a lot of women, they understand they're seen but not heard. At least and for me, it's kind of, what's the word I'm looking for? Like, I'm used to it because I see it all the time, right? I see women like this all the time, and then we explain to them what's going on, and they resonate with it, and they understand, and they've bounced from doctor to doctor to doctor trying to get somebody to listen to them and understand. Unfortunately, now they've developed PTSD of the medical system because nobody's ever listened to them. And then they get here, and now it's like, "Oh my god, you're actually listening to me." And they just it all comes out, and they just let loose, and they're finally in an atmosphere where they can be themselves, and they can be heard, and they can be understood and validated. Um, but you're right, I think without a little bit of, explanation, sometimes the title will get lost in some of that, for sure.
Yeah, well, intuitively, um, and that's my nature.
Yeah.
So you see things like that, but that's not common,
No.
especially in a male.
Mhm. Absolutely not. Yes, you're right.
So it's okay to be a fish out of water in some things because of that, I can relate to
Mhm,
women in ways that is not commonly met.
mhm.
And it's not playing the games of all the come-ons and flirtations and all that. You can just relate to them as a sister,
Yeah.
which that really allows a woman to relax because the sister is a protected place. A
Mhm.
daughter isn't necessarily,
No.
but a sister is generally a very protected place. And
Mhm,
there's exceptions to that. Uh, Years ago, I had a woman come in my office, and she brought her nephew with her, who was about 4 years of age,
mhm,
doing something, and it hurt her, and she's whimpering some. That
mhm.
4-year-old boy came in and sat in the chair, and he just stared at me. And I looked at him and go, yeah, that's right. You're doing what you're supposed to do. That is what you were born to do, to be a protector. And good for you.
Mhm.
And it just affirmed him as I'm working on his aunt,
Mhm.
because that's just devoid in our culture.
Right.
What an opportunity to help nurture that.
Mhm.
He's he's going to be one of those prizes later on
Yeah.
because that's just part of his nature. So in that book, you're addressing neurological issues, you said?
Yeah, primarily neurological issues. So, after my stint at 28, I had a very similar, experience again when I turned, 52, and, had some neurological issues going on, and saw my orthopedic doc because I was convinced it was my degenerative neck that I had.
Okay, this is Dr. Brad cutting in here again. We're going to cut this one short here and continue this in the next conversation. As you can tell, this just been a really deep, personal, raw conversation. It's just been great. So tune in for the next one. We release these every Monday and Thursday for the end of this conversation. Thanks.